Top story at 6. Tippecanoe County Council members recently voted down the health department's request for pandemic hazard pay. News 18's Joe Paul is live tonight outside the county building. Joe, tell us what elected officials on both sides of that issue are saying tonight.
Hey Jeff, only one council member voted in favor of the hazard pay request, saying he wanted to recognize the health department's efforts throughout the pandemic. Other council members, though, voted down the request, arguing that bonuses for some county employees are unfair to others.
I was very disappointed.
Health department staff are feeling underpaid and unappreciated.
An incredible amount of time and energy and resources devoted to our pandemic response over a 2-year period of time, involving nights, weekends, some holidays.
County Council member Jody Hamilton says the pandemic's been tough on all county workers.
The challenge is when you have it just for certain departments when so many people deserve it.
Barry Richard was the lone council member to vote for the hazard pay using a state grant.
It was a good way for us to allow them to utilize the funding availability in the grant to fund some, I guess, recognition and rewards for those staff members that put themselves in such danger.
Adler hoped to reward his employees for going above and beyond their normal duties.
And doing all this at a time where there was, of course, potential exposure to COVID-19.
But Council President Kevin Underwood says there was plenty of risk to go around.
We know full well that as a county, we've got a lot of other folks that went above and beyond during that pandemic same time frame.
Adler's considering what to do now with the unspent money. Health department staff, meanwhile, continue to move forward.
They are very resilient. They're used to facing adversity and performing in the face of that admirably, and they will continue to carry out the mission of the health department.
Adler says the hazard pay would have come from a non-taxpayer funded state grant. The grant collects vaccine reimbursements from health insurance companies and redistributes the money to local health departments. Reporting live in Lafayette, Joe Paul, News 18.